What are my droopy eyelid options? I am 44 years old. My right eyelid is dropping more than the left and causing a very heavy feeling in my eye and irritation. Left isn't so great either, but not as bad. What are my options? Would insurance cover? I am curious of costs if insurance wouldn't cover. Thank you.
Thank you for your question. You submitted a question with photos that demonstrate one eyelid appearing heavier than the other eyelid, and you're asking about options and as well as about whether or not insurance coverage would be appropriate. So, in reviewing your photos, and anytime someone like yourself comes to our practice and we look at heavy looking upper eyelids, we try to first differentiate. Is there extra skin over the eyelids, which is referred to as dermatochalasis? Is the eyelid drooping because of a muscle issue related to the muscle that lifts the eyelid called the levator muscle, and that term is ptosis? And we also look at the brow position. And the eyebrow position can also result in extra skin being pushed downward on top of the eyelid. And we refer to that as brow ptosis. Now, when you look at your photos, it's clear that the brows are relatively asymmetric. Now, this is something that's very much normal. At 44 years old, I would suspect that your brows have not come down significantly, and I would also probably advise against a brow lift because I think with your brows being elevated even a few millimeters, it may have a negative impact on your facial expression and you may look eternally surprised. So I think looking at your photos and looking at the way your eyes appear, where the upper eyelid margin is not low enough to be affecting the pupil, what it appears you have is something called dermatochalasis. And dermatochalasis, again, means extra skin over the eyelids. And for that, the solution is a blepharoplasty. Blepharoplasty basically means to address extra skin, extra soft tissue, extra fat, anything that's impinging on top of the upper eyelid. Now, there is an art to doing cosmetic blepharoplasty in that you want to look natural. You don't want too much skin removed. If you do any kind of online research, one of the most common concerns is the unfortunate event when someone has too much skin removed and they have difficulty closing their eyes. As a cosmetic oculofacial plastic surgeon for 20 years, we have patients who come from all over the world for revision surgery, whether it's for drooping of the upper eyelid after blepharoplasty, as well as skin shortage of the upper eyelid after blepharoplasty. So this is something that cannot be overstated as being so important for your situation. The idea is that blepharoplasty in the upper eyelid is not only about taking as much skin as possible. It really is about the art of the design as well as employing techniques that can allow the skin to fold in properly so that it will look attractive, it'll look natural, and you just won't look as tired. Now, to address the question about insurance coverage, having practiced for 20 years, I have watched how insurance companies have become very, very strategic in the way they represent themselves to patients and to doctors. And if you were to call your insurance company, I would believe it's likely that they would say, well, yes, it would be covered if your doctor shows that it's medically necessary. And this is where the whole industry, the medical industry, became so where there was abuse. And someone like yourself, even years ago, maybe 15 or 20 plus years ago, if you had any kind of visual field defect, it would be something that would be covered. So that unfortunately led to a lot of people abusing the system and a lot of people who did not have a functional issue, a functional reason for upper eyelid surgery were getting covered, and so now the pendulum swung the other direction, and now it's extremely difficult. This is one of the reasons why over 10 years ago our practice, we stopped accepting all insurance altogether. We found the deceptive practices to be completely detrimental to our ability to deliver proper care to our patients. The insurance companies would approve something and then later on deny it, and that's kind of what they do. Looking at your photo, I think that it is unlikely that any medical director of an insurance company would consider your upper eyelids to be heavy enough to be blocking your vision to at least a significant enough degree. Essentially, the general rule of thumb is if someone can see your pupil, that means then you can see out. And it really takes really low eyelids to the point of complete coverage before even an insurance company will consider that. And I have had cases where even then it got denied. So it's no secret my disgust with the insurance companies. So I think that ultimately you'll probably save yourself a lot of hassle by just accepting that most likely this is truly a cosmetic procedure. Identify an expert in upper eyelid surgery. Many doctors perform eyelid surgery. In the hierarchy of specialties, one would argue that a subspecialty or super specialty like oculoplastic or oculofacial plastic surgery is in a position uniquely qualified to perform this type of surgery. So you may want to start there, but certainly you have many, many options, and you can do your research and learn about cosmetic surgeons and other doctors who also perform blepharoplasty. So once you find a doctor that you are comfortable with, move forward, and I think looking at your eyes, I think there's a lot of opportunity to have your eyes looking better after you have this done. So I hope that was helpful. I wish you the best of luck, and thank you for your question.